today being the World Mental Health Day, we are focusing on various mental health conditions, bringing greater awareness to the issue. Now, we have the Principal Secretary of Health, Hadija Kasakun, speaking out earlier this week in regards to mental health. She was advocating for greater understanding and an end to discrimination. So this evening in our lifestyle segment, we will be discussing mental health in the Kenyan context and focusing on the bipolar conditions. It is my pleasure to introduce the guests we have in studio to do so. Ladies first, I believe. So we have Dr. Catherine Mutisya, who is a psychiatrist, and we also have Samuel Boyo, who is a bipolar patient or living with a bipolar condition. So thank you very much for being here in studio to discuss mental health and really bring more awareness to the issue, it being the World Mental Health Day. So Dr. Mutisya, let me begin with you. Let's start with an overall and broad definition of mental health, and perhaps you can give us an overview of some of the conditions that fall into the category of mental health.
Thank you very much. When we talk about mental health, it is the state of well-being in which a person is able to realize their potential, they are able to adjust to stresses in life, and they are able to contribute towards the community. And for somebody to be able to realize their potential, it is very important to be concerned with our feelings, with our thoughts, and with our behavior. Now, when we move from mental health, we move to mental health problems. And when it is severe, now we talk of mental illnesses. There are various forms of mental illnesses, from anxiety disorders, depression, bipolar, schizophrenia, of course, drug abuse, childhood disorders like attention deficit, hyperactivity disorder, conduct disorders. There are quite many. Yes.
Okay, all right. Well, thank you for that. A nice introduction to the topic there. Samuel, let me move on to you. Thank you for being here to come to share your story. And it is this story that we'd like to hear a little bit more about. When did you realize that you first had bipolar?
Okay, I realized that I have bipolar mood disorder for the last 14 years. At first, when I got the mood bipolar, I could not get the diagnosis immediately. So I had to suffer with it inside. Until now, 4 years later, is when now it was diagnosed and I started my treatment.
Okay, so 14 years ago. Prior to that, did you have any of the symptoms or behaviors associated with the condition?
Yes, but when I could go to look for health for the hospital, I could not get the medication. Neither they could not detect what exactly I'm suffering from.
Okay, and within the realm of bipolar and your personal experience, what are some of the symptoms and the behaviors that you have exhibited in relation to bipolar?
Okay, when it comes to the diseases, you feel sometimes you are so high, and others you have the grandioses. You want maybe to meet very important people. Sometimes you think you are so important than the way you ought to be. So it is a state of confusion. Even when you are talking, you talk so much, you switch from one word to another, you don't have flow. That is all symptoms of bipolar.
Okay, and these are some of the symptoms that you experienced?
Yeah, I experienced, yes.
Okay, all right. Well, thank you very much for sharing that. It's interesting to have a little bit of insight to the condition. And Samuel has just shared that with us. So, Dr. Mutisya, I'm curious to if you could give us a medical definition of what bipolar actually is and what it entails.
When we talk of bipolar mood disorder, it has two poles. That's why it's bipolar. There's the pole of high energy, what we call a manic episode, where the person will talk a lot, will think they are very big, what is calling grandiosity. They will lack sleep, they will have a lot of energy, they will not sleep continuously for several days, but during the day they'll be very energetic. They may indulge in drugs and alcohol excessively. They might even become hypersexual. That is the pole of mania. Then that alternates with depression, where now they start feeling sad. they will lose interest in things they ideally were interested in. Some might even get suicidal thoughts. So it has two pores. And the good thing is, with the proper diagnosis and treatment, one can live a normal life. The way you're seeing Samuel here is able to live with a normal life, despite the fact that he's still taking his medication.
Okay, all right, that's quite interesting. And what I'm curious about is the catalysts. Why are some people more or less prone to mental health conditions? Is it environmental factors, or could it be genetic? Why would some people, have a mental health disorder?
It is both. Of course, there is a genetic predisposition, but not everybody in that family will end up suffering from the illness. And again, the environmental factors, based on probably the things you go through as you grow up. You could have traumas as you grow up. Of course, things like psychological stress in the normal daily life. And in some cases where people get into substance abuse, that can also trigger. So it's a combination of several factors. We now know that biochemically there is a biochemical change also. So it is both biological and environment as well.
Okay, that's quite interesting there. Sam, I'd like to come back to you and talk about your experience with bipolar. How have you managed the condition, and how do you cope with some of the symptoms and behaviors that come with it?
Okay, it is very difficult to cope with bipolar disorder, but the time you accept that you are sick, now you start healing. You seek medical attention. You say the doctor will give you, they will direct you to use the good drugs so that you can get well.
Okay.
Yeah.
So is it a fusion of medication and counseling as well?
Yes, counseling, medication, and play also.
Okay,
Yeah.
all right, fantastic.
Yeah.
Dr. Mutisya, we've heard how Sam manages the condition. What would you advise to anybody who might have bipolar or any other mental health condition in terms of the best approach to dealing and managing it?
Yes, the treatment of bipolar involves both medication and talk therapy, what we call counseling. And what is important is for the right diagnosis to be made so that the right medication can be given and the right psychotherapy can be given, because each type of mental illness has a different form of treatment. And it would be very important for those who have been diagnosed to have any mental illness to consistently follow up with their treatment, take their medication if they are advised to, let them continue with the counseling if they have, they are even in the times when they feel stable. Because what happens when people take medication, they stabilize, they feel well, then they stop the medication. And since I've said there is a biochemical change, when now the hormones are in excess, the symptoms come back. So it would be very good for somebody who is diagnosed not to stop the medication or the psychotherapy until they have been advised so by the doctor treating them.
Okay.
Yes.
And where might people go to receive help when it comes to mental health? Are there particular options that you might recommend?
I would advise that if you see your family member or your friend behavior or feelings or thoughts are changing, let them be assessed at the nearest health facility. Right from the health centers, the clinician they find there will be able to assist them, and if they are not able to assist them, they'll refer them to the next level. So whenever you suspect something might be wrong, it would be good for the person to be checked so that if there's an illness which needs treatment, it can be treated immediately.
Okay, and I'm very curious around the costs. We'll talk about bipolar in particular, the cost of the medication, the cost of the counseling. How much does that accrue to, and is it expensive?
Yes, you're right. Treatment of mental illnesses, and specifically bipolar, is quite expensive because we know that the older generation medications have many side effects, and so when you go for the second generation, they are quite expensive. Like Samuel was telling me, even though he's accessing treatment in the government hospitals, he still ends up spending like 200 shillings per day on the medication, which is out of reach for most people on medication alone. So it's quite expensive, and we hope that soon these drugs can be available in the government hospitals for free, so that everybody who needs them can actually be able to access them.
Okay.
Yes.
All right. Somebody wants to talk to you on air, I can see. They're probably excited to see you. Okay, no problem there. All right, Sam, we've heard about Dr. Mutisya talk about the financial aspect of the condition. How do you cope with the expenses, and does it affect perhaps your career and employability?
Okay, treating bipolar for me is very difficult, especially someone maybe who live under the $100 per day. So it is difficult for me. Financial constraint, 200 per day for the drug is not a small money. Yes.
Okay, and this is quite an interesting aspect, the cost of it, particularly if it's a condition that might affect your ability to be employed. So Dr. Mutisya, I'm curious to find out from you about what some of the resources that there might be available, perhaps what the government offers to help with the cost implications that come with mental health.
Yeah, I would say that currently the national hospitals, Mathare National Teaching and Referral Hospital being one of them, Kenyatta National Hospital and Moi Teaching and Referral Hospitals, have most of these medications available for their patients. We are encouraging the county hospitals, because now health is devolved. The county hospitals should also be able to stock those medication, and most of the counties do not have a psychiatrist on board, they do not have psychologists, they don't have nurses. It would be good for the counties to also consider that, because we know that every Kenyan, regardless of whether you're suffering from mental illness or physical illness, has a right to access the best treatment available. So we would encourage even the county hospitals to be able to stock that. In the West, people suffering from mental illness are companies which want to employ them are given tax exemption. We hope that in Kenya we will reach there, so that everybody, whether you are schizophrenia, which is the most severe, or bipolar or depression, you can actually be able to access employment. But as of now, I think the only benefit they would be able to enjoy would be the 30% tenders offered to people with disability and women and the youth.
Okay.
Yes.
All right. This is a very interesting aspect that we're touching on, and on this point of the expense and access to treatment and facilities for mental health. What about communities, marginalized communities in rural areas, as well as impoverished communities? How do they access mental health, and what are the systems around that?
Yes, if we look at the Ministry of Health system, we know right from the health center, then you move to the sub-county hospitals, then the county hospitals, then the county referral hospitals. In those systems, we are able to access mental health care, but a lot more needs to be done. We need every healthcare worker to be able to diagnose and deal with mental illnesses, and they need to be able to realize when they need to refer. Like Samuel has told us, he was wrongly treated for a long time until he was referred to Mathare Hospital. That's the time he was able to access treatment. Okay. So we need to probably retrain our health workers all over the country, so that they are able to diagnose and refer where they are not able to treat.
At an earlier stage.
Yeah. Now, as we run out of time here, I just want to get some comments from you, Sam, on how you manage the condition of bipolar. What are some of the challenges that you face living with the condition, and how have your family reacted and responded in response to the condition?
Okay, my parents have supported me so much when I could not be able. They made me to go to hospital, even if they could not afford to buy me the second generation drugs. They could try what they could. After that, now is when you are sick with bipolar, you are shunned by the people, even your close relatives. They shun you away. Yeah, they could even say you are cursed.
And this is a really interesting point, because we hear of cases and incidents where perhaps families might perceive it as shameful, and there's a lot of stigma around it, and might lock the person who has a mental illness away in a room and totally neglect them. Dr. Mutisya, is this quite common?
Yeah, it's common. We've even seen patients who are brought to hospital when they have developed wounds because they were being restrained using very crude methods. And we also know the other aspect of mental disability, intellectual disability, where some children have, or even adults have had to be locked up. And most of the time it's because probably the community does not understand some of these disorders. They do not understand that they can get treatment. And you find people going to probably look for who has bewitched this person before they even take the person to the hospital.
Yeah.
So we need to sensitize the community to understand some of these disorders and that they can actually be managed in the hospitals.
Okay, and as we wrap up, I think my final question to you, Dr. Mutisya, in regards to mental health. We know that Mathare Hospital is the primary mental health institution. I'm sure that the institution faces several challenges in delivering the services to patients, perhaps with funding or staffing. And as a result, we've had quite a lot of negative publicity, a feature in CNN a few years ago really highlighting that. So my question to you is, what do you think needs to be done to enable the institution to be able to improve the level of care that they might offer to patients?
Yes, you're right. Mathare National Teaching and Referral Hospital has had challenges ranging from shortage of staffing, where you find the number of patients is more than the staffs who can handle them. Of course, medication not being adequate, but a lot has improved so far because since it was made a national hospital, more money has been allocated to the hospital, and now the hospital is able to procure more drugs and improve the facility. The hospital is still overcrowded, meaning that we would need more wards, so that because we find a ward of 40 patients accommodating more than double. Okay. And you find that when you have overcrowding, of course the facilities, the toilet, the water become a problem. So a lot more needs to be done. Okay. We need more space for the patients, and we need more allocation, and whatever is there needs to be managed well so that it goes to the benefit of the patient.
All right, fantastic. Yes. Thank you for that. I think it is a mutual hope that they will receive the funding to be able to address these challenges so that they can deliver the help and services necessary to help people who struggle and cope with mental illnesses. Unfortunately, this is all that we have time for in this evening's interview, but I want to thank the both of you, particularly you, Sam, for coming here, for sharing your story. I think the aim here was to give greater awareness on mental health so that we can bring an end to the stigma. And thank you very much, Dr. Mutisya, also for being here in studio and sharing your invaluable insight on the areas of mental health. So thank you very much to the both of you. And that wraps up our lifestyle interview today, which is the day that recognizes mental health, World Mental Health Day, the 10th of October. I hope the interview has been enlightening to you at home on the issue of mental health, bringing an end to stigma and understanding some of the conditions that fall under that.